Venezuela and China have strengthened their cooperation amid the coronavirus pandemic. Meanwhile, Venezuela has donated COVID-19 test kits to several Caribbean nations. Members of the Organization of the Petroleum Exporting Countries have agreed to reduce oil production to boost prices. The official global COVID-19 death toll surpassed 100,000 on Friday, with more than 1.6 million confirmed cases. From the headquarters of Telesur English in Havana, Cuba, this is On the South. I'm Katrina Goss. Venezuelan President Nicolas Maduro held a phone conversation with his Chinese counterpart Xi Jinping this Friday to discuss the coronavirus pandemic. The Venezuelan president thanked the Chinese government for its continued cooperation in the COVID-19 prevention and control efforts. The Chinese president also confirmed his intention to continue to provide support to the Latin American country, which remains subject to US sanctions. President Xi assured that his government closely follows the development of the outbreak in Venezuela and also the decisive measures that the Bolivarian government is implementing to tackle the virus. China has sent several shipments of aid to Venezuela, as well as a team of medical experts. Venezuelan Vice President Delcy Rodriguez announced in a press conference that 4 new coronavirus cases were detected in the country for a total of 175. She added that 74 patients have now recovered from the virus. The Vice President also highlighted that Venezuela leads the region in terms of the number of COVID-19 tests conducted among its population. Rodriguez explained that Venezuela had donated COVID-19 test kits to several Caribbean nations, including St. Vincent and the Grenadines. Mexico's offered to cut its oil production by 100,000 barrels per day following talks between President Andrés Manuel López Obrador and his US counterpart Donald Trump. This is 4 times less than the Organization of the Petroleum Exporting Countries had requested, but according to reports, the US has agreed to reduce its production by an additional 250,000 barrels per day to support Mexico. The move comes as the 9th OPEC and non-OPEC ministerial conference saw countries propose cuts of as much as 10 million barrels a day in order to boost falling global oil prices in the midst of the coronavirus pandemic. And Mexican President Andrés Manuel López Obrador indicated that the recent lack of agreement between Russia and Saudi Arabia on oil production levels had negatively affected the Mexican oil industry.
The information to the people in this sense is that we are participating in an agreement of oil-producing countries, those in OPEC and non-OPEC, and Mexico will contribute to stabilizing the prices that dropped in recent days. The Mexican mix of $40 per barrel reached 11 at the worst moment, and this was caused by a lack of agreement on reductions in oil production. Basically, there was no agreement between Russia and Saudi Arabia when we held talks, when a conference was held with the presence of heads of state of the G20 group.
Experts have warned that the novel coronavirus could spark a serious crisis in the Latin American region. Reports point to the severe economic impact of the pandemic. Several countries of the region were already facing economic difficulties before the virus hit. Argentina was burdened with huge foreign debt by the previous administration of Mauricio Macri, whose neoliberal drive led to plummeting living conditions for many Argentinians. Ecuador, under the current administration of Lenin Moreno, is facing a similar crisis. Meanwhile, Chile has seen months of wide-scale protests against the Sebastián Piñera government due to acute inequalities in the country. With the global economy heavily impacted by the pandemic, the populations of these countries face even harder times, particularly in the case of those with governments that are unresponsive to the people's basic needs. Meanwhile, in Ecuador, the COVID-19 virus has caused almost 300 deaths and infected over 7,000 people. Ecuador is the second most affected country in the Latin American region after Brazil. The health crisis unleashed in the country has seen the collapse of hospital and funeral services. A Cuban medical team has arrived in Angola to help combat the coronavirus epidemic. 214 Cuban health professionals specialized in disaster situations and serious epidemics arrived in the African nation to support its efforts to contain the virus. Angola has reported 19 cases and 2 deaths so far. In addition to the huge number of Cuban medical personnel already working in many countries across the world, specialized brigades have been sent to 17 countries since the outbreak of the COVID-19 pandemic. And Cuban health authorities offered a televised report on the current COVID-19 situation in the country this Friday. Health Ministry officials and representatives of the Center for Genetic Engineering and Biotechnology offered details of the scientific efforts underway to ensure the best treatments for COVID-19 patients and future immunization. Cuban Minister of Health Jose Portal stressed that Cuba continues to be subjected to a cruel US blockade that prevents access to certain resources. He noted that tasks related to science, innovation and technology have always been present in the plan to combat the virus and have increased as the nation has demanded greater and more accurate solutions. It was also reported that Cuba is in a position to contribute to global science based on the experiences of its experts. Haiti has mobilized troops to support the measures imposed to combat the novel coronavirus. Hundreds of soldiers gathered this Friday at the Anaconda military base to the south of Puerto Príncipe, with the mission of accompanying the population, medical personnel and institutions involved in the efforts. Minister of Defense Sean Dornell informed the troops that they will also be guarding convoys and health centers treating COVID-19 patients. Haiti has reported 30 positive cases and 2 fatalities so far. Guyana's Elections Commission has agreed to a recount of ballots from the March 2nd general elections, this in the midst of the coronavirus epidemic that has claimed 6 lives and infected 37 people.
We have continued on the position that we are going to do a recount. I think we've agreed that the venue which the recount should be done should be the convention center, but of course that is subject to permission being granted to use the center. I would hardly like to think the permission would not be granted.
More stories coming up after this very short break, so don't go away. Welcome back to From the South. The United States has seen over 18,000 COVID-19 deaths and has the largest number of confirmed cases in the world. The US National Institutes of Health announced a clinical trial of hydroxychloroquine, an anti-malarial drug, to test its safety and effectiveness in treating COVID-19. Meanwhile, President Donald Trump claimed on Friday during a coronavirus task force briefing that the death toll in the United States could be lower than estimated because of the preventative measures being taken. With unemployment skyrocketing and the economy taking a massive blow, Trump is keen to lift social isolation measures as soon as possible, even in the face of the health crisis. The total number of cases in the US has now surpassed 489,000. Spain reported its lowest daily coronavirus death toll in 17 days this Friday. The total number of fatalities in Spain is now close to 16,000, while the number of cases confirmed stands at 157,000. Although health authorities say the epidemic has peaked, they have urged the population to continue to observe the lockdown to slow the spread of the virus. The restrictions will remain in place until April 25th, although the government has made clear it expects to announce another 2-week extension.
And on the other hand, another piece of information that we also communicate in this summary is the number of patients cured, which represents 35% of the cases reported, and the total today is more than 55,000 people already cured and out of hospital.
Italy, the European country worst hit by the novel coronavirus, has seen a fall in the number of people in intensive care. Health officials have reported that over 140,000 people have been infected with the virus as local hospitals struggled to cope. 610 people died between Wednesday and Thursday, bringing the country's death toll to over 18,000. Civil Protection Special Commissioner for the coronavirus, Angelo Borrelli, told the nation on Friday that the number of patients in intensive care had fallen by 88. France has reported more than 12,000 deaths due to the COVID-19 epidemic, while the number of cases has increased to over 117,000. The novel coronavirus has infected thousands of doctors, nurses and other health workers across France, but those who have recovered are already back on the front lines.
Our job is to take care of patients, and so I have never thought that I would stay home. I mean, my place was to be at the hospital with my colleagues, with the patient. I mean, I have kids, I have a family, but the place I belong to right now is the hospital because I have to take care of the patient.
And so this is exactly the same for people who have been contaminated. And as soon as they are feeling better, they come back to help, because it's a very hard task, very tricky and very hard situation. And they feel not very confident and very guilty staying at home.
Over 800 people have been killed by COVID-19 in the past 24 hours in the United Kingdom. The total number of fatalities reported in hospitals is now almost 9,000. The calls to stay at home do not mean the same thing for everyone, as many people in the UK have to continue working in order to support their families, with the health crisis highlighting the huge socio-economic inequalities in Britain. The UK now has over 73,000 confirmed coronavirus cases. Europe is the world's hardest hit region by the COVID-19 pandemic, with almost 760,000 confirmed cases. The figure is almost twice as much as that reported in the Americas, according to data released by the World Health Organization. Meanwhile, the current situation in Germany has given reason for cautious hope, according to Chancellor Angela Merkel, speaking after a cabinet meeting dedicated to the ongoing pandemic. Germany now has over 120,000 confirmed cases and has seen more than 2,000 deaths. Merkel said the measures imposed in Germany until now have been sufficient, but stressed that it would be necessary to be very, very careful in relaxing the current restrictions. Governments from the 19 countries that use the euro overcame their sharp differences this Thursday to agree on measures that could provide more than €500 billion for companies, workers and health systems to cushion the economic impact of the coronavirus pandemic. The deal struck on Thursday among EU finance ministers did not, however, include more far-reaching cooperation in the form of shared borrowing guaranteed by all member states.
The package we approved today is of a size close to 4% of European GDP, plus the automatic stabilizers that are quite powerful to protect European economies in case of crisis. This is totally unprecedented. We never ever reacted so quickly to a crisis as this one. Today, we agreed to establish pandemic crisis support for the amount of 2% of member states' GDP. That is close to 240 billion euros. This is an important safeguard for all euro area countries during these times of crisis.
The EU ministers agreed that hard-pressed countries such as Spain and Italy could quickly tap the Eurozone's bailout fund for up to €240 billion, with the condition that the money is spent on their healthcare systems. However, the credit line will expire once the outbreak is over. The deal came after bitter disagreement between Italy and the Netherlands over the conditions for loans from the bailout fund, the European Stability Mechanism. Italy had rejected the idea of using the fund because of the requirement that the money come with conditions to implement reforms, which were called the tough austerity conditions imposed on Greece, Ireland and other indebted Eurozone countries bailed out during the European sovereign debt crisis. And we're taking one final break now, but stay with us for more. Welcome back to From the South. Malaysian Prime Minister Muhyiddin Yassin announced an extension of the controls on movement in the country until April 28th. The restrictions were enforced to prevent the spread of the COVID-19 virus and were initially scheduled to end on April 14th. The Prime Minister has also instructed Malaysia's security forces to enhance border security to prevent the entry of the virus. Parts of the capital, Kuala Lumpur, have been cordoned off by security personnel due to the high numbers of confirmed COVID-19 cases. Restrictions to slow the spread of the novel coronavirus were tightened in the Indonesian capital, Jakarta, on Friday. Jakarta, home to 10 million people, is now the epicenter of the epidemic in Indonesia, with 1,706 COVID-19 cases and 142 deaths. Meanwhile, the overall number of cases in the country has reached 3,293, while the death toll stands at 280. Jakarta's governor announced a decree imposing large-scale social isolation in an attempt to curb the spread of the virus. The decree gives authorities more power to press people to stay at home and businesses to close, and will be re-evaluated every 2 weeks. People who violate the measures will face up to 1 year in jail and a fine. Japanese and South Korean tourists flew home from Nepal on Friday after being stranded in the country as it went into lockdown to combat the novel coronavirus. The Nepalese government halted all flights and ground transportation and shut offices and businesses in order to curb the spread of the virus. Separate repatriation flights took the tourists home on Friday after being stuck in the country for more than 2 weeks. Tourists from other countries, including the UK, US and Australia, have already been flown home from Nepal following agreements with their national governments. Japan has reported over 470 new confirmed coronavirus cases, bringing the total to more than 6,000 on Friday. Earlier this week, Japan declared a state of emergency to stem the spread of the virus in major cities. It has so far reported 112 COVID-19 deaths. On Friday, Kyoto became the latest prefecture to ask to be placed under the state of emergency, with the governor arguing that infections were rising. Meanwhile, the governor of Tokyo said that the metropolitan government would request many businesses, including nightclubs, karaoke bars and betting establishments, to close from Saturday. The state of emergency currently covers 7 regions, including Tokyo, and gives authorities the power to ask people to stay indoors and request that businesses close. However, there are no enforcement mechanisms and no penalties for those who fail to comply. More than half of those infected with the novel coronavirus in Iran have recovered, according to the Ministry of Health. Iran announced another 122 COVID-19 fatalities, taking the death toll to 4,232. The Health Ministry said almost 2,000 people had tested positive in the past 24 hours, for a total of over 68,000 cases. The announcement comes a day before Iran is scheduled to reopen low-risk businesses in a move aimed at protecting its sanctions-hit economy. In response to the health crisis, Iran shut schools and universities, as well as cinemas, stadiums and holy sites, and warned people to refrain from travel. During a virtual press conference from Geneva, the World Health Organization expressed concern over the number of health workers being infected with the COVID-19 virus worldwide.
We are particularly concerned by the large number of infections reported among health workers. In some countries, there are reports of up to 10% of health workers being infected. This is an alarming trend. When health workers are at risk, we're all at risk.
In hospitals, again, as we're dealing with the ongoing situation in Congo, at one point during the outbreak of Ebola in Beni, at one of the most intense periods in the outbreak, nearly 70% of the cases were actually being transmitted within the healthcare system. So it shouldn't be a surprise to us with MERS, with SARS, with Ebola, that the healthcare environment is an environment in which people can be saved and treated, but it is also an environment in which viruses and other things are present, and we need to protect patients and we need to protect those health workers.
The Chadian army said it had wound up an offensive against Boko Haram jihadists in the Lake Chad border region, in which 52 soldiers and 1,000 jihadists were killed. An army spokesman reported that the operation, launched after nearly 100 soldiers were killed last month, ended on Wednesday after the extremists were forced out of the country. This was the first official update on the results of the Operation Bahoma Anga against the Boko Haram terror group, which was launched after Chad's armed forces suffered their biggest one-day loss in their history. The President of Sierra Leone announced a ban on travel between districts as part of a series of measures to combat the spread of the coronavirus. In a statement published on Friday, President Julius Maada Bio also imposed a nationwide curfew between 9 p.m. and 6 a.m, as well as cutting the working hours of civil servants and advising people to wear masks in public and stay at home as far as possible. The measures, due to start on Saturday and last 14 days, come after a 3-day lockdown earlier this week. On Friday, health authorities reported there were no new confirmed cases, while 255 people are in quarantine.
My name is Friday. I'm a reporter.
Nigeria has reported 14 new confirmed coronavirus cases, bringing the total number in Africa's most populous country to 288. 13 of the newly detected infections are located in Lagos, Nigeria's financial capital, and one in Delta State, the location of the oil reserves that power the Nigerian economy. So far, 7 people have died and 51 have recovered. And we've come to the end of this news brief. You can find these and many other stories on our website at telesurenglish.net. And you can join us on social media, Facebook, Twitter and Instagram. For Telesur English, I'm Katrina Goss, and thank you for watching.